Hi, I had a really important question via DM from somebody having watched my last Instagram video. And the question was, or the statement was, my three sisters have all been on HRT and then subsequently got breast cancer. There is no way that HRT did not cause their breast cancer. And I see similar questions come through all the time. So I've had two best friends, they both were on HRT and they both got breast cancer. My aunt had a breast cancer that was estrogen fed, and it must have been the HRT, because otherwise it wouldn't have been estrogen fed. And I just wanted to break down the myths kind of surrounding all of those three issues. So when a young woman receives a breast cancer diagnosis, it's devastating and it's just not what anybody wants, and everybody is shocked and upset, and people often seek to try and find a cause, like what was it that I did that made this breast cancer happen? But the problem with HRT and breast cancer is that the HRT always comes before the breast cancer, and so there is a false bias in terms of attributing the breast cancer to the HRT. Women do an awful lot of other things other than using HRT. You know, we use mobile phones, we eat pizza, we drink alcohol, we might not do enough exercise, we might eat sugar, but nobody links the two. And I think the reason they don't is because some breast cancers, a lot of breast cancers, have estrogen receptors on them. And people therefore think that the estrogen in the HRT has caused that breast cancer to develop. And actually, that's not what typically happens. What typically happens is that you may have, so even in women who have not used HRT, they have estrogen receptor breast cancers. And if you have a tumour there with estrogen receptors on, estrogen can cause that tumour to grow. It isn't that the HRT causes it to initiate, to come into life, but if you have a tumour there and you then take HRT, it can cause it to grow, and it can reveal itself earlier than it would have done if you had not used HRT. If you have a situation where you have three sisters and each of them has used HRT and developed breast cancer, the most likely cause is that there is a genetic predisposition that has caused that breast cancer rather than HRT being the cause. The risk of breast cancer from HRT is actually very, very low, and it is thought that from every 1,000 cases of breast cancer, only 2 of those are as a result of using HRT. The other 998 are as a result of we don't know, or genetics, or lifestyle, or just spontaneous being unlucky. So it's just really important to understand that you're never going to get it the other way around. You're never going to get a breast cancer and then use the HRT because you've already had the breast cancer. It's always going to be that somebody's used the HRT and then got breast cancer, because being on HRT is very common, and unfortunately breast cancer is very common. So there's often going to be that sequence of events, but it's just really important to not attribute causality to the HRT when there could have been there will be lots of other reasons at play. Now, I'm not saying that everybody should be on HRT. I'm just saying that it's a shame for HRT to be blamed unnecessarily in women who actually HRT would be really very acceptable and possibly beneficial, or probably beneficial. So it's just about having that balanced approach and understanding the statistics and what causality means.